Hi guys, this is Troy with the Advanced Spine Joint Wellness Center in Medina with Dr. Matt Meehan today. So you may have heard, but recently we moved to a large 10,000 square foot facility, and we just opened yesterday, June 24th. So pretty exciting, Dr. Matt.
Oh yeah, definitely.
You may also know that Dr. Matt Meehan is voted the #1 chiropractor here in Medina County by the Medina County Lifestyle magazine. And what's unique about the chiropractic care that we do here is that we're integrative. So, Dr. Matt, I was wondering if maybe you could explain a little bit about what's integrative medicine and how does that support you as a chiropractor?
Okay. Yeah. So how it differs from a regular chiropractic office is, here we are, like Troy said, integrated. So not only do we have the chiropractic treatment, but we have other practitioners that help guide the patients along to get better results, different results than they might get in other offices. So we have the physical therapists that are here and his team of physical therapy assistants. We have the medical team, we have massage, we have decompression, laser. So that whole combination is what we use to try to find that underlying cause and help to correct that cause so that we can help decrease people's symptoms, helping get things moving better. And, because of that integration, we're able to do that better than others are.
That's awesome. Do you think as a chiropractor having some of the support staff, like if you look at our reviews online or some of the patient results we get here, it's fantastic. And I had not worked with chiropractors in my field as orthopedic surgery as I was starting in my profession as a PA 10 years ago. But then I started working with you guys and I thought it was awesome. But how do you feel maybe some of the supportive treatments that we do here help you guys be much more effective? Because that's really what it's all about, is helping the patients and getting better results. How does that integration help you get a better result, do you think?
Well, what it does is it allows us to get better movement with people. So as chiropractors, our main goal is finding misalignments in the spine, helping to correct that misalignment, which is going to take the pressure off of the nerves that are causing the symptoms. So a lot of times there's alignment issues, but there's other involvements with that, whether it's tightness and tension in those muscles, whether it's inflammation around that area there. Having the other therapies here, the other practitioners here, we're able to address those problems a little bit easier and people get quicker results with that. So decreasing the tightness and tension with the physical therapy, helping use the medical team, the injections, the massage, different things to help decrease those trigger points, that tight spots in those muscles, so that the adjustments are easier. The patients respond quicker and we get better results because of those other treatments with it here.
Yeah, I agree. And I think there's another couple key points too that I think that we're really good at. Maybe our homework schedule.
Of course, yeah.
I think that the things that we do for homework are critical. And I always like to describe to patients when I'm meeting with them that, coming here frequently, that's another strength of ours, is the frequency and intensity of the program. But homework, and an analogy I think we both use as we're educating and working with patients, is that if you go to a school and maybe you're going to a college course and you go to class 2-3 times a week, but you don't do any studying in between, we're typically not going to have a very good final grade score. But if we go to every class and then we're studying a lot in between, our results of our final exam score in that class are going to be much better. And it's the same thing with our results here. And maybe describe a little bit of some of the homework that we do and what sets us kind of apart, because we don't want to miss some of the simple things at home that oftentimes homework can really complement what we're doing.
Oh yeah, as the patients go through their treatment here, they're getting everything that they need. But like Troy said, we do see them a lot. It's more frequent, especially at the beginning of the treatments. But even with that higher frequency, you're still at home a lot more than you're here in the office. So we're able to give you patients things to do at home, whether it's specific exercises, stretches, but more importantly, some of the things that they do normally during their day, the way they sleep, the way they sit, what they do at work, how they're playing with their kids or grandkids, how they're bending, turning, twisting, all of those activities that we do at home that actually put us back. So our goal is to minimize some of those. We're never going to be perfect with it. So we minimize those step backs that patients can get because of those poor posture, poor use of activities as they're at home. So going through the treatments, you're getting the stuff that you need here, but you're also getting that education so you know what you need to be doing at home, whether it's exercises, stretches, and just these different things that we can do during our daily activities so that you can minimize those little flare-ups that most people get during the treatment. So I always tell people it's more of a 2 steps forward, maybe only 1 or half step backwards. And as we go forward, we're still continuing that progression forward in their treatment.
Makes sense, and I think the homework is a critical piece.
Yeah.
as we expand here, and we continue, we're just about complete with the expansion. Our last step is to bring in a group of neurosurgeons and orthopedic surgeons. And we're going to be affiliating with the Spine and Orthopedic Institute out of Cleveland. And we have 18 surgeons that'll be joining us as a team and working with us here. Maybe talk a little bit about historically how chiropractics and medical providers, maybe physical therapists or surgeons, historically haven't gotten along, and sometimes even in the community don't get along, but how when we work as a group together, how that can benefit the patient. Maybe expand on that a little bit because they'll be here soon.
Yeah, definitely. And most people have heard of that, chiropractors don't like medical doctors or vice versa. But a lot of times it's more of lack of education of what we do individually, so they really don't know exactly what we do. And a lot of times we don't know exactly what they're doing, so we just think of them as, oh, they're just going to go in, start cutting. And they think of us as, oh, you're just going to go in there and they're going to crack you. But there's a lot more. There's a lot more science that goes into it, especially with chiropractors here. So I think the biggest key is having that communication with these doctors, educating them, having them educate us so that we know more about what they do. And it's not going to just be surgery for every single person that walks through the door. Right. So that we're able to work together as a team to find out which path or combination of paths that people are going to go through so that they can get the best results for the patient and not worry about what we think of the practitioner or what they think of us. We need to think more of what the patient needs, what's going to be best for their symptoms, what's going to be best for the cause of their problem, so that we can work together to get that result that the patient's ultimately looking for.
I think that's a key point too that you mentioned. It's about what the patient needs.
Yeah.
And too often I think even we in the community, or sometimes us, if we really look close internally, we can really kind of put our desires onto the patient. But what is it for the patient? How can we benefit them? So I guess to wrap things up, if you could say, hey, here are the things that we treat and treat well. Obviously spine issues, I think we're great with those things, but maybe just rattle off a list of diagnosis. And if you're dealing with these things out there, here are some common things we deal with here, and we're really good with these things. So I'll let you rattle those off too.
Yeah, like Troy said, most people come in with pain, aches and pains. Biggest one we see is lower back pain, lower back pain, sciatic pain, pain down into the legs. That's one of the most common reasons why people come in. Another reason, neck pain across the shoulders, down into the arms. Headaches are a big one. I love treating headaches because they respond so well to what we do. Migraine headaches, all of these, so that you don't have to rely on those medications that people rely on for those aches and pains. Some of the other things that we treat that you might not think chiropractic for, but here in our office, because of the integrated system, we can work some different paths for people. Carpal tunnel is a big one. Neuropathy that we work with a lot. Some of the functional problems that people really don't relate to their spine can be associated with spinal problems. So just some of them, sinus issues, allergies, eye problems, ear problems.
Sure.
Big one that we see is heartburn and indigestion. If someone has issues with their mid-back, a lot of time that's one of the symptoms they have that they don't relate to the spine itself. So our nerves control everything in our body. So anytime that nerve is pinched off, whatever that nerve is going to, it's not going to function properly. So it can be a pain symptom or it can be a functional symptom. But, in general, those are kind of the big ones that we see.
Well, if you're interested in more information about the center and the expansion, stay tuned on Facebook. You can also find us on YouTube or Instagram. You can go online and you can search for us at ohiopain.com. If you're interested in initial consultation, all you need to do is contact us directly, 330-242-7669, and we'll see you next time.